Behavioral Neuroscience, Chapter 2, Segment 4. There are 3 protective sheets of tissue that surround the brain and spinal cord. These protective sheets are known as the meninges. The first and outermost layer of the meninges is the dura mater. The innermost layer of the 3 meninges is the pia mater. And the final layer is the arachnoid, which is the thin covering that lies between the dura mater and the pia mater. Meningitis is the inflammation of the meninges, usually caused by a viral infection. Meningiomas is a non-cancerous tumors that arise from the meninges. Cerebral spinal fluid, also known as CSF, is fluid that fills the cerebral ventricles. The ventricle system is a system of fluid-filled cavities inside of the brain. The CSF circulating through the ventricle system it acts as a shock absorber, so it protects the brain from sudden movements. It provides a medium for an exchange of materials between blood vessels and brain tissue. The lateral ventricle is a complexly shaped portion of the ventricle system that extends to all 4 lobes. The 4 lobes are the frontal lobe, the temporal lobe, the occipital lobe, and the parietal lobe. The lateral ventricle also includes a choroid plexus, which lines the lateral ventricles with CSF. The 3rd ventricle moves the CSF from the lateral ventricles to the 4th ventricle. The 4th ventricle is located between the cerebellum and the pons and receives the CSF and releases it to surround the brain and the spinal cord. The vascular system. In the vascular system, the brain is 2% of the weight of the human body. However, it consumes 20% of the body's energy while at rest. So the brain is supplied by a complex set of arteries. The first arteries being the carotid arteries. They are major arteries that ascend the left and right sides of the neck into the brain. They supply blood to the anterior and middle cerebral arteries. Anterior cerebral arteries are 2 large arteries that provide blood to the anterior poles and the medial surfaces of the cerebral hemispheres. The middle cerebral arteries are 2 large arteries that provide blood to most of the lateral surfaces of the cerebral hemisphere. The posterior cerebral arteries are 2 large arteries that provide blood to the posterior aspects of the cerebral hemispheres, the cerebellum, and the brainstem. Vertebral arteries are arteries that ascend the vertebrae, enter the base of the skull, and join together to form the basilar artery. The basilar artery supplies blood to the hindbrain, which includes the brainstem and the posterior cerebral arteries. The circle of Willis is a structure at the base of the brain that is formed by the joining of the carotid and basilar arteries. This allows for an alternative route for blood flow if any of the main brain arteries are damaged or blocked by disease. A stroke is a clot that interrupts the supply of blood to the brain region, which causes the affected area to stop functioning and die. Warning signs include numbness, altered vision, dizziness, severe headache, and difficulty speaking. To recover from a stroke, the victim needs to be treated immediately. Pericytes are small cells that encircle and support brain capillaries. These capillaries are resistant to the passage of large molecules, and that is because of the blood-brain barrier, which protects the brain from infections and blood-borne toxins. Brain imaging techniques. X-rays can't resolve all of the brain's small variations in density, so there are multiple techniques to try. Angiography is a specialized X-ray image of the head, and the head is taken shortly after the cerebral blood vessels have been filled with a radiopaque dye. This helps with diagnosing vascular disease. Computerized axial tomography, or known as the CAT or CT scan, is a non-invasive technique for examining brain structure in humans through computer analysis of X-ray absorption. And this has a medium resolution and is useful for visualizing strokes, tumors, or cortical atrophy. MRI, or magnetic resonance imaging, is a non-invasive technique that uses magnetic energy to generate images that show structural details of the living brain. This is a higher resolution than CT scans, and there are 3 parts that encompass an MRI. The first being a patient's head is placed in the center of a powerful circular magnet that causes all protons in the brain's tissues to line up parallel. The protons are then knocked over by strong radio waves. And then a powerful computer uses density-based information to generate a detailed cross-sectional map. The next technique we'll look at is positron emission tomography, also known as the PET scan. This technique for examining brain function by combining tomography with injections of radioactive substances used by the brain. This is focused on brain activity as opposed to structure. A functional MRI, also known as an fMRI, is an MRI imaging that detects changes in blood flow and shows the regions of the brain that are particularly active. The amount of oxygen is measured indirectly on the basis of blood flow or the state of hemoglobin, known as the bold signal. This shows cognitive processes and reflects synaptic inputs and local processing, and this has a higher resolution than the PET scan. Diffusion tensor imaging, also known as DTI, is a modified form of MRI where the images in which are the diffusion of water in a confined space is exploited to produce images of axonal fiber tracts. There is something known as the connectome, which is the dynamic patterns of information flow within a network of fibers, and this is the basis of neuroscience. Optical imaging is a method for visualizing brain activity in which near-infrared light passes through the scalp and the skull. This reveals activity of the cortical regions. Transcranial magnetic stimulation, also known as TMS, is a non-invasive stimulation of cortical neurons through the application of strong magnetic fields. There is also repetitive transcranial magnetic stimulation, RTMS, which the magnetic stimulation of the brain is cycled several times per second. There is something known as SQUIDs, superconducting quantum interference devices, which are ultrasensitive detectors. Magnetoencephalography, also known as MEG, is a non-invasive functional brain imaging technique that measures tiny magnetic fields produced by active neurons. Lesions are regions of damage within the brain. When dealing with techniques, there is something known as the speed-accuracy trade-off. Some technologies produce very fine resolution and are slow to create images and thus are poor at tracking brain activity changes, while some are very quick at tracking brain activity changes but do not have very good resolution. There is a broadening field of neuroscience, and that is called social neuroscience, which aims to understand brain activity as it relates to our interactions with others. They can take measurements of peripheral physiological responses to social interactions, such as salivary measurements or hormonal changes. Finally, a didactic functional MRI, DFMRI, is when the brains of two interacting people can be studied at the same time once they lay out.